Hello friends, welcome back to NITU Nursing Insights. I hope you are all doing well. In today's video, we are going to discuss one of the most important topics in intravenous therapy, the complications of peripheral IV cannulation. This is a topic that every nursing student and practicing nurse should understand thoroughly because peripheral IV cannulation is one of the most frequently performed clinical procedures in healthcare. Although IV cannulation is considered a routine nursing procedure, it is not without risks. If complications are not recognized and managed promptly, they can lead to patient discomfort, interruption of treatment, tissue injury, infection, prolonged hospitalization, and in severe cases, life-threatening complications. As nurses, our responsibility extends beyond successful cannula insertion. We must continuously assess the IV site, identify early warning signs of complications, provide timely nursing interventions, and implement evidence-based preventive measures to ensure safe and effective intravenous therapy. In this video, we will discuss each complication in detail, including its definition, causes, risk factors, clinical signs and symptoms, nursing assessment, immediate nursing management, preventive strategies, and important clinical points that every nurse should know. The common complications of peripheral IV cannulation include infiltration, extravasation, phlebitis, local infection, IV catheter occlusion, hematoma. By the end of this video, you will have a clear understanding of how to recognize these complications early, manage them appropriately, and prevent them in your daily clinical practice, helping you provide safer, evidence-based patient care. So without further delay, let's begin with the first complication, infiltration. Infiltration. What is infiltration? Infiltration is the accidental leakage of a non-vesicant intravenous IV fluid or medication from the vein into the surrounding tissue due to displacement or damage of the IV catheter. It is one of the most common complications of IV therapy. Causes. Common causes of infiltration include dislodgement or movement of the IV catheter, puncture of the vein wall during insertion, fragile or damaged veins, improper catheter stabilization, high infusion pressure, repeated cannulation of the same vein, excessive patient movement, especially when the cannula is inserted near joints such as the wrist or elbow. Risk factors. Certain patients are at a higher risk of developing infiltration, including infants and elderly patients, patients with fragile veins, unconscious or confused patients, patients with poor peripheral circulation, patients receiving long-term IV therapy, patients with diabetes mellitus or peripheral vascular disease. Early warning signs. The IV site should be assessed regularly for the following signs: swelling around the insertion site, cool skin compared with the opposite limb, pale or blanched skin, tightness around the IV site, pain or discomfort, slowed or stopped IV infusion, leakage of IV fluid around the cannula, difficulty flushing the cannula. So early recognition is essential to prevent further tissue damage. Our nursing assessment. When infiltration is suspected, the nurse should stop the IV infusion immediately, assess the IV insertion site carefully, compare the affected limb with the opposite limb, check for swelling, skin temperature, skin color, and pain, assess circulation, sensation, and movement of the affected limb, estimate the extent of infiltration, document all assessment findings accurately. Nursing management. If infiltration occurs, stop the IV infusion immediately. Remove the IV cannula. Elevate the affected limb to reduce swelling. Apply a warm or cold compress according to the type of solution infiltrated and the hospital policy. Monitor the affected area for improvement. Insert a new IV cannula at a different site if IV therapy is still required. Educate the patient to report worsening pain, swelling, or discomfort. Document the incident and all nursing interventions. Prevention. To prevent infiltration, follow these important nursing measures. Select an appropriate vein and the correct cannula size. Secure the cannula properly to minimize movement. Confirm cannula patency before starting IV therapy. Assess the IV site before, during, and after administering IV fluids or medications. Avoid placing the cannula over joints whenever possible. Encourage the patient to report pain, swelling, burning, or tightness immediately. Flush the cannula according to hospital policy to maintain patency. Possible complications. If infiltration is not recognized and managed promptly, it may result in significant swelling, pain and discomfort, delayed IV therapy, reduced tissue perfusion, nerve compression in severe cases, need for repeated IV cannulation for nurses. Extravasation. What is extravasation? Extravasation is the accidental leakage of a vesicant, medication, or solution from the vein into the surrounding tissue during intravenous IV therapy. Vesicant drugs can cause severe tissue injury, blistering, skin necrosis, and long-term tissue damage if they are not recognized and treated promptly. Extravasation is considered a serious complication of IV therapy and requires immediate nursing intervention. Examples of vesicant medications. Examples include certain chemotherapy drugs, some vasopressors, calcium solutions, concentrated potassium chloride, certain antibiotics, other vesicant or irritant medications, causes of extravasation. Extravasation may occur due to dislodgement of the IV cannula, vein perforation during insertion, fragile or damaged veins, high pressure infusion, poor cannula stabilization, inappropriate vein selection, prolonged use of the same IV site. Risk factors. Patients at increased risk include older adults with fragile veins, infants and young children, unconscious or sedated patients, patients receiving vesicant medications, patients with poor peripheral circulation, patients who are unable to communicate pain or discomfort. Early warning signs. The nurse should immediately assess for burning or stinging sensation, severe pain at the IV site, swelling around the cannula, tightness of the surrounding tissue, pale or blanched skin, cool skin temperature, slowed or stopped IV infusion, blister formation in severe cases. Nursing assessment. When extravasation is suspected, the nurse should stop the infusion immediately, assess the extent of swelling and tissue involvement, check the skin color, temperature, and capillary refill, assess the patient's pain level, identify the medication involved, monitor for signs of worsening tissue damage. Nursing management. If extravasation occurs, stop the infusion immediately. Do not flush the IV line. Leave the cannula in place if required by institutional protocol for aspiration and antidote administration. Disconnect the IV tubing. Notify the physician immediately. Administer the prescribed antidote if indicated. Elevate the affected limb. Apply warm or cold compresses according to the medication involved and hospital policy. Monitor the affected site regularly. Document the incident and all nursing interventions. Possible complications. If not treated promptly, extravasation can lead to severe tissue damage, skin ulceration, tissue necrosis, infection, nerve injury, functional impairment of the affected limb, need for surgical intervention. Prevention. To prevent extravasation, assess the IV site frequently. Select an appropriate vein and the correct cannula size. Secure the cannula properly. Verify blood return and cannula patency before administering vesicant medications. Monitor the patient closely during the infusion. Educate the patient to report burning, pain, or swelling immediately. It is a serious complication of IV therapy that can result in significant tissue injury. Nurses play a critical role in its prevention, early detection, and immediate management. Careful monitoring of the IV site and rapid intervention are essential to protect patients from severe complications and ensure safe intravenous therapy. Phlebitis. What is phlebitis? Phlebitis is the inflammation of a vein, usually occurring at or near the site of an intravenous IV cannula. It may result from mechanical irritation, chemical irritation caused by IV medications or fluids, or microbial contamination. Phlebitis causes pain and discomfort and may interrupt IV therapy. If left untreated, it can increase the risk of infection and thrombophlebitis. Types of phlebitis. 1. Mechanical phlebitis. Mechanical phlebitis occurs due to physical irritation of the vein. Causes include a large cannula inserted into a small vein, poor cannula stabilization, excessive movement of the cannula, cannulation over joints. 2. Chemical phlebitis. Chemical phlebitis occurs due to irritation caused by IV medications or fluids. Causes include hypertonic solutions, highly acidic or alkaline medications, rapid infusion of irritating medications, inadequate dilution of medications. 3. Infective bacterial phlebitis. Infective or bacterial phlebitis occurs when microorganisms enter the vein. Causes include poor hand hygiene, inadequate skin antisepsis, breaks in aseptic technique, contaminated IV equipment. Risk factors. Patients at increased risk include older adults with fragile veins, patients requiring prolonged IV therapy, patients receiving irritating medications, immunocompromised patients, patients with poor percolation, patients requiring frequent cannulation at the same site. Early warning signs. The nurse should assess for redness around the IV site, warmth over the vein, pain or tenderness, swelling, a hard cord-like vein, pain during infusion, slowed IV flow, fever if infection develops. Nursing assessment. Assess the IV site regularly by checking skin color, skin temperature, pain or tenderness, swelling, hardness of the vein, IV flow rate. Many hospitals use the Visual Infusion Phlebitis VIP score to detect phlebitis early and guide appropriate management. Nursing management. If phlebitis is suspected, stop the IV infusion, remove the IV cannula, assess the affected area, apply a warm compress to relieve pain and inflammation if appropriate, elevate the affected limb if swelling is present, insert a new IV cannula at a different site if IV therapy is still required. Inform the healthcare provider if signs of infection or severe inflammation are present. Document all assessment findings and nursing interventions. Possible complications. If phlebitis is not treated promptly, it may lead to increased pain and discomfort, local infection, thrombophlebitis, inflammation associated with blood clot formation, interruption of IV therapy, bloodstream infection in severe cases. Prevention. To reduce the risk of phlebitis, perform hand hygiene before and after all IV procedures. Use aseptic non-touch technique, ANTT. Choose the appropriate vein and cannula size. Avoid inserting cannulas over joints whenever possible. Secure the cannula properly. Dilute irritating medications according to recommended guidelines. Flush the cannula as recommended. Inspect the IV site frequently. Remove the cannula as soon as it is no longer clinically indicated. Phlebitis is a common but preventable complication of IV cannulation. Regular assessment of the IV site, adherence to aseptic technique, appropriate vein and cannula selection. Local infection. What is local infection? Local infection is one of the complications of IV cannulation that occurs when microorganisms enter the cannula insertion site, causing inflammation of the surrounding skin and soft tissues. It usually develops due to contamination during insertion, poor catheter care, or prolonged use of the same IV cannula. If not recognized and managed early, a local infection can progress to a bloodstream infection or sepsis. Common causes of local infection. Common causes include poor hand hygiene before IV cannulation, failure to use proper aseptic technique during insertion, inadequate skin antisepsis before cannulation, contaminated IV equipment or dressings, loose, wet, or soiled dressings, frequent manipulation of the IV site without proper hand hygiene, prolonged cannula dwell time beyond hospital policy or clinical indication, immunocompromised patients, such as those with diabetes, cancer, or those receiving immunosuppressive therapy. Early warning signs. Assess the IV site regularly for redness around the insertion site, local warmth, swelling, pain or tenderness, purulent or pus-like discharge, foul odor from the insertion site, fever or chills if the infection begins to spread. Nursing assessment. The nurse should inspect the IV site during every shift and before administering medications. Ask the patient about pain, tenderness, or discomfort at the insertion site. Compare the affected site with the opposite limb. Monitor the patient's temperature and other vital signs. Observe for signs of worsening infection, such as increasing redness, swelling, or drainage. Nursing management. If a local infection is suspected, stop using the affected IV cannula. Remove the cannula using aseptic technique. Assess and document the condition of the insertion site. Inform the physician or advanced practice provider. Obtain a wound swab or catheter tip for culture if prescribed. Administer antibiotics as ordered. Insert a new IV cannula at a different site if IV therapy is still required. Continue to monitor the patient for signs of local infection is a common but preventable complication of IV cannulation. Careful assessment, adherence to aseptic technique, and timely nursing interventions are essential to prevent serious complications and ensure safe, high-quality patient care. IV occlusion. What is IV occlusion? IV occlusion is a blockage of the intravenous IV cannula or IV tubing that prevents the normal flow of IV fluids or medications. It is one of the most common complications of peripheral IV cannulation. An occluded IV line cannot deliver treatment effectively and may delay patient care if it is not recognized promptly. Causes of IV occlusion. IV occlusion can occur due to several reasons, including kinked or compressed IV tubing, closed roller clamp or stopcock, blood clot formation inside the cannula, the cannula tip resting against the vein wall, patient movement such as bending the elbow or wrist causing the cannula to kink, medication precipitation due to incompatible drugs, failure to flush the cannula before and after medication administration, mechanical obstruction due to improper catheter positioning. Early warning signs. The nurse should assess for the following early warning signs: slow or stopped IV fluid infusion, resistance when flushing the cannula, IV infusion pump alarm indicating occlusion, blood backing up into the IV tubing, difficulty administering medications, patient complaining of discomfort during flushing, absence of free-flowing IV fluids. Nursing assessment. When IV occlusion is suspected, the nurse should inspect the IV tubing for kinks or compression, check that all clamps are open, assess the insertion site for swelling, redness, pain, or leakage, ensure that the IV fluid bag contains sufficient fluid, ask the patient to straighten or reposition the affected limb, check whether the cannula has become displaced, assess the cannula for patency. Nursing management. If IV occlusion occurs, stop the infusion temporarily. Check the IV tubing, clamps, and connections. Reposition the patient's arm if the cannula is inserted near a joint. Assess the cannula for patency. Flush the cannula gently with normal saline only if appropriate and there are no signs of infiltration or extravasation. Never force the flush if resistance is felt. If the occlusion cannot be resolved, remove the cannula. Insert a new IV cannula at a different site if IV therapy is still required. Document the assessment findings, nursing interventions, and the patient's response. Prevention. The best ways to prevent IV occlusion include flush the IV cannula with normal saline according to hospital policy, use the correct flushing technique and the recommended syringe size, secure the cannula properly to prevent movement, avoid inserting the cannula over joints whenever possible, check the IV tubing regularly for kinks or compression. Administer compatible medications and flush the cannula between incompatible drugs. Assess IV patency before administering medications. Encourage the patient to avoid excessive bending of the limb with the IV cannula. Possible complications. If IV occlusion is not managed promptly, it may lead to interruption of IV therapy, delayed medication administration, increased risk of infiltration or phlebitis, need for repeated cannulations causing patient discomfort, increased risk of infection due to repeated cannula insertion. IV occlusion is a common but preventable complication of IV cannulation. Early recognition, careful assessment, and prompt nursing interventions help ensure uninterrupted IV therapy, reduce complications, and improve patient safety. Hematoma. What is a hematoma? A hematoma is a localized collection of blood outside the blood vessels that occurs when blood leaks from a damaged vein into the surrounding tissues during or after IV cannulation. It is one of the most common complications of peripheral IV cannulation and usually appears as swelling with bluish or purple discoloration around the insertion site. Although most hematomas resolve without serious consequences, a large or expanding hematoma can cause pain, delay treatment, and make future venous access more difficult. Causes of hematoma. A hematoma may develop due to accidental puncture through both walls of the vein during cannulation, vein injury during insertion or removal of the cannula, multiple unsuccessful cannulation attempts, inadequate pressure applied after cannula removal, fragile veins, especially in older adults, patients receiving anticoagulant or antiplatelet medications, excessive movement after cannulation causing vein damage, poor stabilization of the cannula. Risk factors. Patients at higher risk include older adults with fragile veins, patients receiving anticoagulants such as heparin or warfarin, patients with bleeding disorders or thrombocytopenia, dehydrated patients with small or fragile veins, patients requiring repeated venipuncture. Early warning signs. The nurse should monitor for the following early warning signs: swelling around the insertion site, bluish or purple discoloration, bruising, pain or tenderness, firmness beneath the skin, blood leaking around the cannula, difficulty flushing or infusing through the cannula. Nursing assessment. The nurse should assess the size and extent of the swelling, the color and progression of the bruising, the severity of the patient's pain, the patency of the IV cannula, circulation, sensation, and movement of the affected limb, evidence of continued bleeding. Nursing management. If a hematoma develops, stop the infusion immediately. Remove the IV cannula if it is no longer safe to use. Apply firm, direct pressure over the site for several minutes until bleeding stops. Elevate the affected limb to reduce swelling. Apply a cold compress or an ice pack wrapped in a cloth for 15 to 20 minutes during the first 24 hours to reduce bleeding and swelling. After 24 to 48 hours, a warm compress may be applied according to institutional policy to promote reabsorption of the collected blood. Insert a new IV cannula at a different site if IV therapy is still required. Document the incident, nursing interventions, and the patient's response. SHAD prevention. To reduce the risk of hematoma, select an appropriate vein and cannula size. Stabilize the vein during cannulation. Avoid probing with the needle. Limit the number of cannulation attempts. Secure the cannula properly. Apply firm pressure after removing the cannula, especially in patients receiving anticoagulant therapy. Inspect the IV site regularly for early signs of bleeding or swelling. Possible complications. If not managed appropriately, a hematoma may lead to increased pain and discomfort, delayed IV therapy, compression of nearby tissues or nerves, difficulty obtaining future venous access due to bruising, patient anxiety, and reduced confidence in future procedures. Hematoma is a common but largely preventable complication of IV cannulation. Careful insertion technique, appropriate vein selection, secure cannula stabilization, and proper pressure after cannula removal are essential nursing practices. Early identification and prompt management help minimize complications and ensure safe, effective patient care. That brings us to the end of today's session on the common complications of IV cannulation. As nurses, successfully inserting an IV cannula is only the beginning. Equally important are continuous assessment, early recognition of complications, timely nursing intervention, and adherence to evidence-based infection prevention practices. Remember, most IV cannulation complications, including infiltration, extravasation, phlebitis, local infection, IV occlusion, and hematoma, are preventable with appropriate vein selection, correct cannulation technique, regular monitoring of the IV site, and prompt action when early warning signs are identified. Providing safe and effective intravenous therapy is a fundamental nursing responsibility that directly contributes to patient safety, comfort, and positive clinical outcomes. I hope you found this video helpful and informative. If you enjoyed this video, please like, share, and subscribe to NITU Nursing Insights for more evidence-based nursing education, clinical skills, nursing procedures, and exam preparation, including Prometric, NCLEX, DHA, HAD, MOH, and other nursing licensing examinations. If you have any questions or topics you would like me to cover in future videos, please let me know in the comments section. Thank you so much for watching and for your continued support of NITU Nursing Insights. Stay safe, keep learning, keep caring, and I'll see you in the next video.